everyone. I want to welcome Dan Farkas. He's going to be chatting with us today about functional medicine and how functional medicine can improve our mental health. So, Dr. Farkas, I'd love to just have you tell a little bit more to us about functional medicine and some of the work that you do and how you got involved in becoming a functional doctor.
Awesome. I'm Daniel Farkas. I'm in Troy, Michigan, and I've been a doctor for about 16 years now. And my doctorate is in chiropractic. So for years, I saw clients coming in for the typical chiropractic things, neck and back pain, of course, and then you'd have your wellness clients from time to time that like to use chiropractic to boost their immune system. But I just started to see a lot of conditions show up over and over that I wasn't able to help. Use the natural means, saying, hey, get some, clean up your diet, get some exercise, get your spine adjusted, get some rest. Those things weren't working because it's just pretty clear that it's become an overstressed, hypertoxic world, and that there's so many things added to our food and added to our diet that get in our body and get it out of balance. So I knew there had to be more. And then through some mentorship, I was turned onto the field of functional medicine. And here we are years later.
Yeah. Can you tell us a little bit more about what exactly functional medicine is and how it's a little bit different than conventional medicine?
Sure. So the functional medicine, the analogy I've made is there's functional and then there's static. I also call functional medicine dynamic medicine. Static medicine would be traditional allopathic medicine, where if you go to a medical doctor, they will ask you what your symptoms are, and then they'll prescribe a medication to try to alleviate your symptoms. Now, the field of medicine is fantastic, especially in the United States, and they really shine in the emergency room. They will save your life. When it comes to functional medicine, though, or dynamic medicine, if you will, what that looks at is how things work in real time fluidly. How are the body systems actually working, and what got people into those states of poor health or having symptoms? Like what got them there? For example, high blood pressure, high HbA1c, marker for diabetes. Like what got them there? The interesting thing about functional medicine is the whole foundation of it is what is going on inside the gut. And I'm going to be talking about the gut a lot as I answer questions. The gut is the small intestine. So eat food, we chew food, we digest it. It goes into our stomach where hopefully it gets digested properly. Then it moves into the area that I call where the magic happens, the small intestine, which actually has more nerves and nerve tissue in and around it than the whole spinal cord. It is its own brain, and it's got a lot of demands, and it's very bossy, and it has complete control over the immune system. So it turns out that the immune system, which is used to keep us alive, can sometimes get out of balance chronically, and chronic low-level inflammation causes all type of health problems, especially in children. And when it applies to behavioral health, chronic low-level immunity causes a malfunction of the body's manufacturing and utilization of things called neurotransmitters like serotonin and dopamine to keep you feeling good and not anxious or depressed and make it so you can sleep. So as we keep talking more, I'll go in deep as you like about the gut and how it works. But the foundation of functional medicine, what's going on with the gut? Start there. That is our base, and that's what we work off. And to date, the Cleveland College has gotten a $120 million grant from the United States government, the Cleveland Clinic, in order to study the gut, what they call the microbiome, all the bacteria and yeast in there, and what they mean to behavioral health. Because antidepressants and psych meds and things that help with their mood and their behavior, those are very popularly prescribed. So science, even medical science now has turned around and said, wait a minute, I think we got to look at what's going on in the gut, which is like the factory for the things that make us feel good and not have behavioral health problems by and large. So, but that to me, that's functional medicine in a nut. What's going on with your gut?
Yeah, and I'm really hearing that it sounds like a big cause for things like anxiety and depression, some mental health symptoms we might be experiencing have to do with inflammation in our gut.
Yes, yes. You know what, I just, but before we even go on, I want to talk about just really how that works. the bacteria and the yeast that live in our gut, it's its own microcosm. It's its own living micro ecosystem. And it houses and stores about 90% of the body's supply of neurotransmitters, if you will. It's like your storehouse for your feel good stuff in your body. These little things called neurotransmitters that control how nerves talk to each other. When things are balanced, those things crank out the way they're supposed to. But when things get out of balance, when the gut gets disturbed, thinks there's possibly a foreign invader, what it will do is it will mobilize the immune system, and the cells that hang out and line the gut, instead of producing those feel good substances, they start making immune factors. Just like back in World War II, Detroit stopped making cars and they started making tanks and helicopters. That's exactly how it happened. So when I see someone, they're like, man, I'm suffering with behavioral health, I got anxiety, depression, I want something better. What's the natural approach? I said, we got to get your factory to stop making tanks and helicopters and start making cars again like it's supposed to. But that's, to me, that's how I understand how it works.
Yeah, no, and I think that's like a great example too. And I'm curious if you can tell us a little bit more just about how the microbiome plays a role in our mental health, and especially with anxiety and depression.
Sure. I talk about neurotransmitters. Sounds like a big word, but when we break it down, we see neuro, we see nerves and transmitters. And what that means is this is how nerves communicate and talk to each other. So our brain is our big main nerve, of course, and it sends messages down the spinal cord and then out all the levels of our spine to every one of the trillions of cells that makes up our body. It's pretty neat. It's like we are wired in. I tell my clients we don't run on Wi-Fi. We run on hard wires, and this is how the body takes care of itself and not only tells the body what to do, but listens to its needs too as well. So the neurotransmitters, what they are is they are substances, if you will, that live at junctions where nerves turn in and connect into other nerves, and we call it the synaptic cleft. This is called a bulb. This would be the synaptic cleft. And what happens is neurotransmitters sit and hang out here. And then electrical impulse across the course of a nerve comes along and zaps and says, okay, you guys, neurotransmitters, jump over there. And then keep sending that good message or bad message, if you will, along that nerve out to wherever it needs to go. So if you have the right neurotransmitters in place at the right plentitude, right time and place, what you get is this sensation that's transmitted throughout your body and wherever it needs to go to keep things balanced, calm, and feeling serene and peaceful. I love the word peace and serenity. Those words I talk about, that's my goal for the human body: balance, peace, serenity. If the transmitters are working and they're plentiful like they're supposed to, hopefully you get some peace, tranquility, and serenity. But if they're not, if the factory that makes and houses those things is offline, making tanks and helicopters, if you will, that those substances aren't going to be there in that synaptic cleft and zap, zap, zap all you want, that's not going to happen. So when we look at something like antidepressants, for you guys that might know, be familiar with those, sometimes they call them SSRIs, selective serotonin reuptake inhibitors. And all that means is that they want to make it so that on this side of this cleft, that the feel-good substances, the neurotransmitters, don't just jump back and get stuck over here. They want to keep them over here on this side. Our approach is just to get the factory back online that makes those, so that we have those in plentitude as much as they need, so one side doesn't get greedy for it. But that's one way how the SSRIs work, and then our goal is to just magnify the amount, the quantity, and the quality of the neurotransmitters.
Yeah, it's really fascinating. And I'm curious, if someone might have a gut disruption, what are some of like the symptoms they might be feeling in their bodies other than depression or anxiety?
Oh, interesting. Basically, autoimmune system run wild. The gut, to me, it's like a thermostat. It can turn up inflammation, which is activity, if you will, of the immune system. So when we see the word inflammation, we just think immune system activity. It can turn it up or it can turn it down. Some people say, boy, I have numerous autoimmune diseases. Why is my immune system going haywire and declaring war on my normal healthy body tissues? That would be it depends who you ask. There's somewhere between 120 and 140 established autoimmune diseases. That's just a glaring red flag that there's some type of disruption in the gut. Any type of autoimmune disease. Real common one would be a thyroid problem called Hashimoto's hypothyroiditis. That's where the immune system declares war on the thyroid. It makes it not function well. And boy, when that thyroid starts malfunctioning, it starts functioning low, that directly affects mood. It affects sleep, body temperature, hair growth, et cetera, et cetera. So the autoimmune diseases are the ones that really jump out at me. Certainly things like when client comes in and says, I had bowel cancer, they removed 2 feet. I say, well, they definitely have some type of compromise there. Crohn's disease, diverticulitis, and or what we call irritable bowel syndrome, alternating
Mm.
constipation and diarrhea. And a lot of my clients, no digestive complaints whatsoever. They just
Oh,
look right at me and they say, I'm fine. I go to the bathroom once or twice a day. Nothing really bothers me. If I, eat McDonald's, have a big milkshake, if stomach doesn't feel good, but I have no problems. Probably the toughest cases sometimes are the ones without symptoms of overt gastrointestinal problems, but they have the behavioral issues, the anxiety, the depression, and the medication use. So, yeah, and
right.
autoimmune disease is the one that really screams. Yeah.
Yeah, totally. Yeah, that really makes a lot of sense. I know you kind of started talking about like the thyroid, and that made me start thinking about like how hormones play a role in our mood as well. And I was wondering how you might work with hormones or help people check their hormones if they might be out of balance.
Yep. Great question. Hormones are so important. Hormones are like big bosses. They're managers. They show up on scene. They tell everybody what to do. We've all had a job somewhere. Maybe it was at a restaurant. You're like, oh, here comes the boss. Here comes the manager, or the
Mhm.
general manager shows up. The hormones, they tell our body, that they direct our body systems. And the two most common types of hormones I check for are stress hormones and sex hormones. The stress hormones would be things called DHEAs, but more popularly, what is real common in culture is cortisol. Cortisol is the stress
Mhm.
hormone. There's a lot of commercials on TV and et cetera about the stress hormone, cortisol. Cortisol is secreted by the adrenal glands when we run out of blood sugar during times of stress, but we can't run on that. It's like a credit card, and you can't live on credit cards. If you keep tanking out your paycheck and you keep using your credit card, the balance is going to get real high until your credit gets cut off. And then we go into adrenal fatigue and adrenal crash, which strangely, those conditions, which are they destroy people's lives, they ruin families, they're not recognized by modern medicine. They say, nope, doesn't exist, which is strange because I can measure them with simple saliva tests. The same for the sex hormones too, as well. One of my favorite tests is called a Dutch test. It's a dried urine test where we get samples of saliva and urine for gals. It's on day if they're still menstruating. It's on days 19, 20, or 21. We collect the saliva and the urine, and then we use that to look for off levels of sex hormones. And we all have male and female hormones. We all have
Mhm.
testosterone. We all have estrogen. Men and women do. Interestingly enough, though, you asked a good question about the testing. A lot of times my clients will come and they'll say, they test my cortisol, it was fine. And I'm like, how did they test it? Oh, they checked my blood. Or they tested my estrogen and it was fine. And I'm like, okay, how did they test it? And they said, well, they took blood, which is, it's important, but to me, that's just a small sliver in time of where they are. I like the functional approach or the functional medicine approach. We're on a certain day of gal cycle, or on an average stress day, we always say for men or women, we want to get 4 samples from the beginning of the day all the way to the evening of the saliva and of the urine. And then we can use those to chart a graph. And then that will tell us how the body's actually functioning, how it's actually moving fluidly and dynamically through the course of a day. And then gratefully, we're able to use just natural substances like herbs and to help the body balance the sex hormones and then to support the stress hormones too.
Yeah, yeah. I'm kind of curious a little bit more about like what herbs you prescribe, or it sounds like I'm guessing you don't use as much pharmaceutical medication unless it's really necessary, right?
Yeah, that's true. It is rare. Sometimes I do refer to natural-minded doctors that do have the power of the pen to prescribe things when necessary. It is quite rare, though. I have to say, it's rare. It's almost gone. As a matter, it is so rare that I have to have somebody get what we call hormone replacement therapy or HRT. There are ways around it. It's taken so long. Frankly, even through the course of my career, I started studying this field a little over 20 years ago. And even at that time, natural science had not caught up to medical science. But now, anything short of emergency room procedures, it's like I say, if you cut your finger off, don't bring it to me. But if it's not in the emergency room, there is virtually something natural that's made from plants that has virtually no side effects or danger that can help just as good as medication or even better in a lot of cases. Not every single case, but in many, many cases, we're able to use natural things and natural compounds. So frankly, the people have spoken. The market is what people said. We want something natural, and as consumers put more money into those products, then more quality ones were being able to be developed. And now there are products that we even call them medical foods, not because there's medication in them, but because they're made from food from plants. But they're so powerful that they have the same effect as medication in the same amount of time too as well, with virtually no side effects, completely safe for anyone, men, women, no matter how old or how young somebody is. Even small children, people bring me babies that are months old that we're able to help them. But using natural things, it's not. We have the science now, basically, is what I can say. The research I can name. There's a large number of companies that they have gotten the money and the people and the labs and the findings, double blind, randomly clinically controlled placebo studies that show over and over where they keep just trouncing medicine. So I'm glad to be able to use those.
Yeah, and I'm sure that's relieving to a lot of people because a lot of people sometimes are put on lots of different medications now and they're causing all sorts of side effects.
Yeah,
I'm curious if like you're noticing that there's side effects with some of these natural herbs, or is it less than prescription medication?
I would say by tremendously less. The only problems that we ever see with the herbs is that if somebody's body can't process them, if they have, and a lot of times it's with severe liver congestion, or the people, frankly, and it does happen. I smile and laugh about it. It's not funny, but people bring huge, huge Costco big burlap bags full of supplements. And I'm like, I look at them, I say, and a lot of money too. And I said, you take all this? And they say, yeah, I take this, I take this. And it takes them 10 minutes to pull them all out of the bag one by one, and they line them up. And I say, I look at these things, I look at supplements and especially vitamins, even water soluble vitamins like vitamin B. I look at those like they are medications. And I say, this has an effect on your body. Yes, it's natural, but it has an effect on your body. You wouldn't just randomly walk behind the counter at CVS and just start, taking pills that that's what it looks like. It might be able to help me. And I'm like, that to me, the massive amount of supplementation is the problem I think that people get themselves into. And that's because they try things without guidance. And yes, there's a lot of money in natural supplements and vitamins and minerals and all that. But I say very, very rarely should anybody, aside from even a daily vitamin, even vitamin D, vitamin B, not used properly, can cause problems. So I see very little problems except when they're just like medications, when they're abused. Sounds terrible. Opioids have a place. If you have severe surgery, rebuild on your shoulder, you're going to need Vicodin or hydrocodone or oxycodone for about 48 hours to get over that miserable pain. Otherwise, you'll just roll around on the ground. That's how it's meant to be used. But again, it's the abuse is the problem. But to be real clear, when it comes to the natural things, virtually no side effects. You just kind of got to get people off all the unnecessary things. Use them in a focused and targeted way. No problems.
Right. Yeah, that's great. So I'm curious what sort of advice you would give someone who's struggling with anxiety or depression and how functional medicine might be able to help them and maybe some first steps they should take.
Sure. Um, two places to look. Number one, the gut. Ad nauseum, you're going to hear me talk about the gut. Why? Because that's the factory. Whether they have digestion problems or not, and the way you figure out what's going on inside somebody, analyze what comes out of them. I never thought I'd be the poop doctor, but we send test kits all over the world, as a matter of fact, that people can use. They can provide a sample, and that goes off to lab, comes back, and then we have results. We just use some people are familiar with what we call the 4R approach: remove, replace, repair, and restore. Remove the bad things that are in the gut using natural antimicrobials. Replace missing digestive factors like digestive enzymes or bile. Super important. Repair the gut wall using medical foods that are highly effective. And then finally, restore or re-inoculate the healthy bacteria and yeast that are supposed to be in there. That's the, tell me what your question was again. I think I got off a little bit.
No, yeah, you're definitely hitting all those points. Yeah, I was we were kind of talking about how like some advice that you would give someone who's
Ah,
experiencing
yeah, for anxiety
anxiety
depression.
problems.
Thank you, thank you.
Yeah.
So evaluate the gut, employ 4R. Do that first. Start there. I've had people come in with cancer nodules. They say, I don't know where to start. What should we do? Should we check this? I'm like, start in the basement, start at the very bottom. The next place to look would be for stress hormones. For saliva samples over the course of one day on an average stress day, not a heavy stress day or a light stress day, an average stress day, that can chart and map the cortisol. That feeling of anxiety, a lot of times what that is it's dysregulation of blood sugar. And I know when I was a
Mhm.
child, definitely a teenager, I had some pretty ferocious anxiety. My parents chose not to medicate me, and I just toughed it out. It was not easy. Now I routinely check myself on a yearly basis. I check my cortisol levels, make sure they're not getting out of hand. Sometimes I administer herbs to myself in order to keep them balanced. But blood sugar, huge. That's something else to be checked too. Insulin and HbA1c, see if anyone's pre-diabetic or full-blown diabetic. I find them all the time. They had no idea. So you ask a great question. It's like, okay, anxiety, depression, sleep problems. Where do I start? Get your gut checked and then measure your stress hormones too as well. That's a great place to start. There's a lot of ways to skin the cat, but that's a great place to start.
Hey, awesome. Yeah, and I know earlier we were talking a little bit about adrenal fatigue, and I'm curious, how functional medicine helps with that because I know that the recovery from adrenal fatigue can sometimes take a long time.
Yeah, you're right. Adrenal fatigue, again, what makes it super difficult? Not recognized by modern medicine. Why? Because there's no drugs that treat adrenal fatigue. They can't, our good medicine practices come from the people that make and develop drugs, and to date, there are no drugs for adrenal fatigue. Some people have they get cancer in their adrenal glands, or they were born without one, or they're too small and not functional. Those people need to take hydrocortisone for the rest of their life, and then they should do okay. But what can happen, the adrenal glands, like I say, they're like your credit card, and they can get run. You can run your balance up, and then the creditors say, no more spending for you. When it comes to adrenal fatigue, there are about 5 major phases. The first phase is what we call the resistance phase. That's where you start making more cortisol. The cortisol curve that should be, cortisol should be really high in the morning, about 6 a.m., and to get you out of bed and get you started. Then by 9 a.m., it should go down. And what should take its place is blood sugar too. So in the face of a resistance phase, once we check the saliva, we'll see an elevation of cortisol. It'll be high, 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 high all through the day. And I always say it 4 times because the first sample is the first thing in the morning, second sample is late morning, next sample is around dinner time, last sample is before bed. So it's high, 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 high. That's phase one, the resistance phase. That one, not hard to fix. They got to get a handle on their stress. They probably have to see a professional counselor in order to control, alt, delete, and reset their life and their priorities and get back to who they are and what they really love. That's what happens. They just get from the feeling of being responsible is what I say. It's responsible people that get adrenal fatigue. It's always not fair.
Yeah.
I use specific herbs to pull the adrenal output down back to where it belongs. So there's 2 components to that. So we herbs that bring the adrenals down and bring cortisol down would be like ashwagandha and rhodiola, American ginseng, green tea. Those things all work wonderful to help to pull it down. But one thing they have to do is they need steady blood sugar. And I add, sounds crazy, I add carbohydrates to their diet, but a special type, complex carbohydrates. The complex carbohydrates are broken down slow and steady throughout the course of the day, and they don't spike and slam the blood sugar. And those are quinoa and brown rice. I like to administer, I tell people, I go, don't you do a half a cup breakfast, lunch, dinner, quinoa, brown rice, keep your blood sugar steady. And for the people that wake up all through the night at 3 o'clock in the morning, can't go back to sleep, sometimes they have to eat right before bed to keep their blood sugar steady. So that's a phase one resistance. Phase two means that some are high, some are low, some are high, some are low. And then depending on where it's high or low, we'll use an herb to either pull the cortisol down, or once in a while, you have to use an herb to stimulate, to bring it up. And what that usually is licorice. That's a popular one. Big weird word, glycerinated licorice. It's stimulatory. Say someone's they're like, man, I can't get out of bed. I'm just in agony. I just cannot get up. I say, Right at 6 a.m., you're going to wake up. You're going to use some licorice. That's going to get you going and moving through the day. And then maybe at noon, we got to give you something to bring it back down, keep the blood sugar steady. Work with your counselor, work with your mental health professional. And counseling is critical. People, this is like an aircraft carrier. It's not a speedboat. It doesn't turn quickly. People need ongoing counseling in it, probably for life. If you ask me, I think we could all improve probably for life in order to turn them around and get them back on track with their priorities and what their real truth is to themselves. So the phase 2 is some are up, some are down. Phase 3 is where it gets bad. Credit gets maxed out. Creditor says no more credit card for you, and that's where up on the tests we see low, 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 low. This is where it gets kind of hairy. There are 4 phases of phase 3, A, B, C, and D. Each one gets worse. By the time you get to a 3D, you're probably not getting out of bed too much. You're not doing a lot for yourself. Someone's driving you to the store. Your family's worried about you. People are probably helping you with your affairs. That's when we use the stimulatory herbs very, very carefully, but blood sugar is critical. We have to use complex carbohydrates maybe 6 times through the day to increase the body's ability to regulate its blood sugar and balance its adrenals. Vitamin C and vitamin B5 and B6 are very critical, as long as we're not toxic in B6, and vitamin D is super important. I had probably one of the biggest turnarounds I ever saw in the nicest young gal in the world. Man, she was just burned out. You could just see it. She couldn't even follow what I was saying. Her vitamin D was one of the lowest I've ever seen. She had a vitamin D level of about 11 in her blood, and it should be above 30, or even medical science will say something bad's going to happen to you. I like to see the levels above 50. So phase 1, resistance, everything goes high. Phase 2, high, low, high, low, high, low. Phase 3, A, B, C, and D is just worsening phases of low, low. And then by the time you hit phase 4, you were likely bedridden and living in what research calls living hell, where you can't sleep, but you have no energy to get up and get out of bed. Your big plan for the day is when you're going to get up and go to the bathroom. Family is more than worried about you. You're probably living at someone's house. And then phase 5 is institutionalization and heavy medication. I firmly believe there are many, many people, who knows how many, that are living in institutions, and they say they're horribly clinically depressed. They just can't get up and move, and they can't sleep either. And that will drive someone mad, not being able to sleep. And they can develop conditions from lack of sleep too as well. So my goal is to, like I say, I don't get them at phase 5, and rarely, sometimes I get them around phase 4, and it is a turnaround time. Once you start treating them properly over the course of days and weeks, you can see some pretty darn good change out of them. I had adrenal fatigue phase 3C is what I think I had after I woke up from a hernia surgery, and just the surgery and the drugs and everything, it just wiped me out, and I couldn't sleep, couldn't eat, couldn't do anything. But you're over the course of weeks, once you get the right thing in the right place and the right time, and compliance and counseling in place too as well, then you could see a pretty good turnaround. But I tell anyone, I go 6 months to a year. And one more thing I got to say, the workout times. The healthiest people in the world give themselves adrenal crash because they wake up in the morning. I don't eat, I go right to the gym. I grab I don't do nothing. I jump right on the exercise bike. Worst thing in the world. Because what happens is they start to live on cortisol. They live on cortisol because they don't give their body enough blood sugar. People on crash diets too. Oh, it's terrible, terrible. Body goes into hypercortisol mode. You go through phase 1, quickly into phase 2, quickly into phase 3. Now they have adrenal crash, and people think they're crazy. But I'm glad we talked about that. Those 5 phases are important, and it's important to know where you're at. And that's where simple saliva test, not hard, not expensive. I've had people look at me like, it saved my life. They're like, I was going to die of a heart attack or something. I was going to end up, I don't know what was going to happen to me. And I said, yep, I know the feeling. I have been there, and I know the feeling.
Yeah. And some of the comments about kind of like eating more complex carbs and things like that made me think about how there's all these fad diets going on right now, like the keto diet and paleo diet and vegan diets. And I'm curious, from like a functional approach, like how does functional medicine approach diet?
Good question. The answer is, it depends. I love food sensitivity testing. I'd probably say the top 3 tests I do would be stool test, of course, number 1. Next most popular would be food sensitivities. So these aren't, I say these are not allergies. Like if you get stung by a bee or you eat a strawberry and your neck breaks out red, those are what we call IgE responses, immunoglobulin E. That just means soldier type E, as in your blood gets mobilized. Not those, but IgGs, immunoglobulin Gs. These are sensitivities that go up and go down. Food sensitivities come from either having a damaged gut wall or what some people call intestinal permeability, aka leaky gut, from having leaking gut syndrome, or from eating the same thing over and over and over again.
Mhm.
The diet recommendations that we make for people, I love doing it off of food sensitivity testing. I say, hey, pretty simple. Any food you're sensitive to now, we're going to take it out of your diet for about 60 days. Let everything calm down, and your sensitivity will go down and it will go away. My mantra is I don't guess, I test. Now, I'm a paid speaker for Whole Foods. Whole Foods had me do a 4-part lecture series about elimination diet. It's great. Elimination diet is fantastic. You take out common allergens like meat, like milk, I would say dairy, wheat, gluten, certain types of nuts, eggs, and things like that. It's a general approach, but it's just not as specific as doing some tests. My goal for my clients at the end of me working through their conditions is to say, I want you to use food as medicine, truly use food. Like my friend, Dr. Josh Axe says, great guy. I love that guy. Food is medicine. He coined that phrase and he popularized it. I want them to use the food to control and dial up and dial down how their body behaves. You pointed something out great about, like, fad diets. Keto is to try to get your body into ketosis from just burning fat and no carbohydrates or 5% carbs a day. It sounds great if you don't have any adrenal problems. B, if you're not diabetic at all. C, if you don't have any type of thyroid problem at all. But if you have any of those, that is going to put your body into super overdrive stress mode. It doesn't like that at all. Why? It is easier for your body to get energy from sugar and carbohydrates than it is from fat. It is very hard to get energy from fat. It's pretty easy to get some heat and some flame from throwing gas on a fire. That's like what burning carbs is. It's harder to get energy and fuel from throwing wood on a fire. But we know that if you put wood on the fire, it's a lot more consistent. It's a way better fire. It's way better quality. It's going to give you what you want. That's the difference between carbohydrates and fat. But yeah, keto diet, Atkins type diet. There are other diets where it was just carbs, no fat, no protein, just carbs. They really had those. This was not too many years ago. Kind of strange, but yeah, it's a great question. Like, what's our take on diet? I like to eat right for your body type. Some people do the eat right for your blood type. I think that's great too. But I'm just a fan of blood food sensitivity tests. They're simple kits. We send them out all over the world. Real simple. You poke your finger, feels like nothing. Give me about 5 drops of blood on a little card, mail it off to a lab, comes back with recommendations. We usually check for about 184 foods in an adult, 96 foods for a child. But that's how I diet, to me, it's a holy and sacred thing. And just like a fingerprint, or just like counseling, for example, it must be individualized. And I like to empower the people to take control of their own diet and say, look, hey, how about maybe like every 2 years, just check your food sensitivities and shy away from those foods you're sensitive to. Last part about that, it's like, why? The food sensitivities, they cause chronic low-level inflammation. If you twist your ankle, it swells up real big, and then when the repair is done, the swelling goes away. That's acute inflammation. It's your friend. What is your absolute enemy is chronic low-level inflammation. That's what causes that long-term disruption of the gut, the neurotransmitters. It's a precursor to cancer, cardiovascular disease, diabetes, and arthritis too as well. Chronic low-level inflammation that causes problems. And the one way that you can help that is by taking away foods you're sensitive to with a simple test. Like you say, you see how I do it. I don't guess, I test. I love testing.
Right.
Yes. Yep. Good question about diet.
Yeah. Yeah. And I'm starting to think about kind of, a lot of people who have like a lot of gut disruptions, what I notice in my practice are people who have a history of substance abuse disorders.
Sure.
Um, and I'm curious how functional medicine might be able to help people who are recovering from substance abuse.
Sure. It sounds like the same thing over and over and over again, but it's like gut. Look at their gut. Look at the factory that makes them feel that makes the things that make them feel normal. And I got to tell you, by the time people are seeking treatment for substance abuse, life has taken its toll on them. Substance abuse takes precedence over proper nutrition, proper exercise, rest. You can forget all those things. Um,
Mhm.
Checking their gut and their factory for their neurotransmitters is a great place to start. And then stress hormone testing too, I would say. Sometimes I do see some different type of subclinical infections in people too, depending on the type of drugs and their behavior too, as well. What their social behavior was too during their bout of using. But when it comes to the functional medicine approach, I lecture around a lot, and one of my favorite places to go is an inpatient hospital called Maple Grove. It's over in Bloomfield, Michigan, and it used to be young people. It's not all young people anymore, and a lot of people are there for opioids, of course, drugs, alcohol. And I sit in a group of them. It's usually somewhere between anywhere from like 8 to 20, usually around 12 seems to be the magic number. And I say, hey, before I even get started, any of you guys ever have digestion problems and the hands are just go up? And they're like, yeah, they said I had this. Yeah, I had this. Or yeah, as a kid, I probably had about 30 or 40 rounds of antibiotics that disrupted and destroyed their gut. And I
Right.
said, you guys know that the factory that makes the things that make you feel normal and good is like offline, like completely. Like, or I would say, do any of you have diabetes, any type 1 diabetic? A lot of hands go up. I go, that's autoimmune disease of the pancreas. Got any other problems? Like, yeah, look, I have psoriasis. Young people too, 20 years old, they say, look at this. I have psoriatic arthritis. I have rashes all over my shoulders, my arms, my thorax. Like, what's going on? I'm like, yeah, autoimmune disease. But I look at these signs. These people are smart. It's like just because someone develops dependency issues doesn't make them ignorant. They know their bodies, and they all have a story. Every one of them. And then they can also have childhood trauma. You can have adult trauma too as well. But they all have a story. And I'm glad that we have a functional medicine approach that's pretty simple. Get your gut checked, and then let's see where you're at as far as your stress hormones too as well.
Mhm.
Mhm.
Right. Yeah, I'm curious if you could share a little bit more about what a first appointment's like with you.
Oh, I like facts. I'm a science guy. I like facts. I like to get histories on people. I say any history, any old doctor's records you have, I want to see them because I want to see where you came from. I want to see where twists and turns went, with your health. I want to see what your medication history is. Some people don't have any records. They say, I don't know, I don't really have anything at all. I broke my arm 3 years ago. And I say, that's okay too. But we always start with a history, which, and it's nothing against medicine at all, but they're kind of like end of the line. What's your symptom? I have a headache. Okay, great. Here's medication. Get out of here. What's your symptom? My back hurts every day. Here, take these opioids. Get out of here. Instead of doing that, I use the symptoms as just road signs is where I need to kind of look a lot deeper. But it's always about going back into their history. We have to take that's the first that's what I was taught. And that's what I learned from my mentors. History, 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 history. You can't wait. Their symptoms are important. They give you signs. Again, it's like a map of where you should start looking, like a treasure map. But day one with me is history. We're going to spend time. I'd say most of my first day appointments are no less than 30 minutes, 60 minutes, sometimes beyond. We gather history, and then at that point in time, I'll be able to determine what testing that they actually might need. And then we're able to issue them test kits. And if we talk to them virtually over the phone, like a big majority of virtual, all of our clients right now happen to be virtual. Then we're able to mail their kits to their house safely, discreetly too. They're able to give samples. Sometimes I got to get blood from people, and no matter where they live, I'll find a local lab where they can use lab services, walk in there, no appointment necessary. Once we have the results, then I'm able to work a plan that I don't just employ during the short term. As I move through I'm jumping ahead a little bit, but as I move through the process, I want them to learn that the word doctor means teacher. I got to teach them how to take care of themselves, or this will just be short-lived, just like a prescription running out. I hate that. I don't want to be that. I want people to graduate and learn to take care of themselves and give them the tools. And just like the dentist does, he gives you toothbrush, dental floss, and toothpaste for free every time. He says, here, take care of yourself. See you in 6 months or a year. That's what I want. So, but first day, history. Got to go deep in history and then order some labs right away. Mhm.
Mhm. Cool. And I'm curious, because it sounds like going through that functional medicine approach, depending on the person, can be an intensive approach. So I'm curious, what kinds of people would be ready for this approach, or what kind of qualities would they need to have to be able to approach this?
Well, I don't like it to get to the point, I don't want, I don't like human suffering, but unfortunately, sometimes people have had to go through the ringer. They've had to have tried everything. They tried everything with traditional approaches. And then for a lot of people, that was a long time ago. Now they've been trying things on their own and they've just hit a wall. They got the giant bag of supplements, or they're just at a loss and they just get confused. When they're at a point to where they're almost willing to try anything, it does make it a little easier on me. And I will tell you, a good fair number of my clients are in healthcare. They're healthcare providers. They're experienced doctors that have been doctors longer than I have too, as well. And they tried everything. They tried the medical approach. They tried the natural things that they knew. And a lot of them would say, I knew enough to be dangerous to myself. And I tried this and I tried that, and they can get themselves in some bad spots. So I would say the person that's best for me to start with is someone that's already kind of natural health minded, or they got a little rebellious spirit to them. They like to swim upstream and not do things the traditional way, but also to be at the point to where they are just open to something new. And I meet people wherever they are. Excuse me. Some people, they don't believe in vitamins and minerals and supplements. I'm like, hey, great. The good news is the long-term answer to your problem is not vitamins and minerals and supplements. It's food. Does that make sense? And they're like, yeah, that makes sense to me. But always just meet people where they are. Everyone has a story and everyone's individual. And it's like, if we focus on that, then great things happen.
Right. And I think it's really awesome how you take this approach of letting people trust their own wisdom and what's coming up for them and some of their values and things like that.
Yeah, I like it too. It's like you have to listen. The doctor's job, and sometimes the hardest thing to do is to listen. But when you have a huge caseload and you got to see 130 people in a day, and you got about 3 minutes or less with each person, you don't get to listen to them too much. But that's why I'm glad. And that's why I work outside of the system, if you will. I work outside the constraints of what the system is, which you go sit in the cold, exam room on the wax paper on the table with the gown on, and the doctor runs in there and their hands on the door the whole time while they're talking. I found that my clients, you asked a good question about what type of person is good for me. People that are tired of that, and people know that they intuitively know that they have that. It's great. What you said is like it's so profound. The person has the solution. They are the solution to their problem. They just got to get it out, and someone just has to listen to them and just help them put the pieces together. And like I say, even healthcare providers that are way more experienced than me, even they need help, and I get help from time to time too.
Yeah, of course. Yeah, we all need help sometimes. And it's usually our inner wisdom that leads us to that help.
Yes, yes, it's in there. It is in there. And intuitively, people want to do things natural. We all have that inborn wisdom, or I use the word innate. We have that innate intelligence. It's always seeking out. It's always trying to come out and get past our fears, our judgments of ourselves. And that's where counseling comes in. Counseling is critical. Counselors that understand about this. And I know modern medical psychiatric approach is a lot of medication heavy, but now there are functional medicine psychiatrists, functional medicine podiatrists that work on the feet. All these different fields are getting permeated by functional medicine. That's all about what the heck's going on in your gut and what are you eating and putting in you.
Right. Yeah. And so I know a lot of times when people become interested in integrative or functional medicine or even other types of alternative medicine, such as acupuncture, they realize their insurance doesn't cover it. And sometimes it can be really costly to pay for out of pocket. And I'm curious how you work with folks who might be having financial hardships.
It's interesting. I tell people, I go, call me, I will help you. People call me, Doc, I have no money. I went broke. I spent everything. I'm living at my mom's house. I have nothing. I don't have a job because I have serious adrenal fatigue, or they're racked with pain. They have systemic inflammation. They say, I lost it all. I lost everything. What can you do for me? I have nothing to give you. And I go, but you have a lot that you can give me, and you have a lot that you can do. We can institute the lifestyle changes and the diet changes you can get a hold of your psycho, mental, emotional state too as well. There's so much that people can do for nothing. I
Mhm.
start there and I say, now the next baby step would be, how about a simple saliva test to see where your hormones are? Can you do something like that? Yep, maybe so. Some people come in serious, like big heavy duty, the heavy thick American Express card, and they hand it to me and they say, do whatever you need to do. You can do anything. Even them, I look at them and I say, it's not necessary. You don't have to do that. It doesn't take $10,000 to figure out what's wrong with you. You'd be surprised how affordable it is. I do got to say too that the people have spoken, and the market has made it as such that back in the day, like to get a comprehensive stool test, very few companies did them. Actually, one did for the longest time. Stool tests, a couple $1,000s or more. That's out of reach for a lot of people. Food sensitivity testing, $1,500, $3,000, and it just went up and up and up. Now it's a fraction of that, and I feel that anyone that has a cell phone can probably afford this type of care. But I help anybody anywhere. I've never refused anybody for fees. But what could somebody probably expect? The answer, it depends. It depends what your problem is. But for your average problem, over the course of a year, it might cost you 200 or 300 bucks a month over the course of a year, an average. And then after that, hopefully nothing. My goal is to get it down to where people just use a maintenance probiotic, maybe once or twice a week, maybe a little vitamin D, but they eat the right food for themselves, and they take care of themselves. And but those supplements that should cost maybe 80 bucks a year. That's where we want to get people. So I tell people, this is not an expense; it's an investment. You're not just going to buy something from me, some test that's going to change your lifestyle and change you, honoring or not honoring your internal wisdom.
Mhm.
That's something that someone else has to help you with your priorities to get back to who you really are and you doing the things that you really love. But the short answer to short question is I can help them no matter where they are. I guarantee their diet's off. I guarantee that they have studied and Dr. Googled themselves to insanity to where I can give them some clarity on what they can do. And then I just offer steps. Again, some people, they dive in head first. They don't care what it costs. I have people, they say, this is all I got left. This is the last of it. I spend it all. This is it. I got this much room on my credit card. What can we do? And I say, it's always enough. We can always make a change no matter where people are.
Yeah. Have you noticed if any insurances will cover the cost of this care at all or any of these
More,
tests?
more and more, it is a difficult situation because medical insurance, if we kind of look at the word medical insurance, is for the medical approach. Fire insurance at your home is for if your house lights on fire, not for if you wreck your car, of course. So someone
Mhm.
says, well, hey, I got health insurance. I go, you got medical insurance. That covers medical care. That's drugs and testing, surgeries, testing to determine what drug you need to be put on, and they'll pay for your medication. They'll pay to amputate your foot, but they won't pay to put the time and energy in you to train you to not be diabetic, of course.
Right.
Um, that is, we will see it. The people have spoken. It's going to be more and more and more in our lifetime. We're going to see it where integrative approaches, which it benefits the insurance company too. We have showed that. I could talk about this forever. We have showed them over and over and over again. Look, here's the for example, SIBO, small intestinal bacterial overgrowth, massive overinfestation of bacteria in the gut. They could use a very, very, very expensive drug for 3 days, and it's almost guaranteed for that bacteria to go down and come back with a vengeance. Or we can use simple herbs, oregano and berberine. Over the course of 8 weeks, it costs about 40 bucks, and the outcomes are way, way, way better. The problem is that medical at large in the United States is controlled by the people that make and sell drugs, and they're the biggest companies of all time. They're the Holy Roman Empire of commerce. They have more money and more power. They're bigger than the United States military. They have everything. But people think, gosh, the information age, the internet, computers,
Right.
everybody knows how to use one. Even little old people know how to use a computer to get information. And the time will come, I believe, it, when they have true health insurance and the ideas of medicine being in control of everything go away. But we are seeing where there are some instances where medical insurance can pay for some really important testing, traditional medical testing. I order routinely, like thyroid labs, CBCs, average blood panels. Those are real important. Of course, you're always going to get help with that, but more and more, almost by the year, the specialty labs that cover stool testing, stress and hormone testing, and food sensitivities, it is increasing. I'd say a lot of times we use the HSAs, the health savings accounts, or flex spending accounts.
Right.
More and more providers offer that, where they say, "Hey, you're gonna have a higher deductible, or a crank your deductible from $1,000 a year to 5,000. But guess what? We're gonna give you a $3,000 HSA. We'll pay half, you pay half, and people have thousands of dollars to use towards their health." So that's just a great development, and it really helps give people a lot of access.
Right, for sure. Yeah, so I'm hearing that, there's always a place for people to come in to receive help, and there's ways that they can work with their insurance companies as well to get the
There,
testing that they need.
there is a way. Yep. There's always a way. It might not be the best way, but it's progress. And once a door gets open towards progress, it's amazing the miracles that happen, and the things that manifest and show themselves when you wake up that wisdom inside of them, and then they it's all in lifestyle. Lifestyle is what got them there. I always say the cure is the cause. What got you there? That's the
Right,
cure. And it's lifestyle. It's old traumas that puts goggles on people, that they then see the world through the eyes of that traumatized, injured person. They have to go back and do that healing that causes them to make the choices that got their physical health. I treat the end result of all their physical, psycho, emotional stresses. That's exactly what happens. When I see someone that's morbidly obese, I see a person that's hurt. They're toxic, not just physically, but spiritually. Something allowed them to get to that point. When
right,
people's health goes down and they don't take immediate action on it, I'm like, you have to go back with someone who's a trained professional, and you have to get help to fix those wounds that caused this behavior that got you in to see me. I'm not the total answer to your problem. I'm going to help to get you back on track, but you got to go back and fix the things in the past that got you here.
right. Yeah, and I think that it's really great taking a holistic approach to health, because it is all about like the mind, body, and then also those spiritual things that happen to us throughout our lives. It could be trauma or some of the root causes of anxiety and depression, and that's a great way we can work together integratively, is just by, it sounds like you take part in helping with the biological end of things and looking at some of the behaviors and lifestyle changes that need to be done physically. And then in mental health, we kind of look at, where does some of that stuff come from and how do we heal it in a more habitual, behavioral, spiritual way.
Absolutely. I mean, frankly, I'm the same thing as allopathic medicine. I just handle it a natural way, and I just look for the cause of what physically is going on with you, but it's the spiritual, psycho emotional behaviors, self-esteem, things that get people into those messes. So I'm like, look, I'm not the end. I am not the answer to your problems. You are the answer to your problems. You just need a guide that's patient, loving, compassionate, and consistent to heal those wounds that cause you to have these behaviors that got you into seeing me. But this is not the end of your road. This is the beginning of you turning around, going back, fixing those problems, then circling back and getting onto your path to health through what you're just to, I love the concept of somebody getting back to what they love. I think people just aren't living what
Totally.
they really love and what they were put here to do. And those traumas get in the way. So I'm glad that we met too as well, because it's rare that I come across someone that kind of gets it. It's like people have old traumas and injuries. We all do. I don't care who you are, from a prince to a pauper. You have something in there that has to be remediated and fixed. Otherwise, you either keep going, either three things: you keep suffering, you keep going to the medical route, or you keep coming back to see me. But if you can go back and fix those things, great long-term results. And my goal is to get it to where they can help others. Simple as that. Where they
Right.
can go on the road and see people and hear their story and say, hey, I know what you need to do. Yeah, sure, you need to fix your gut and your body naturally. That's the easy thing. But you got to go back and double back and fix those things. And it's a more stressful, traumatic, toxic world than it's ever been before, full of more stressed out, toxic, and traumatized people. So we got to make
Right.
a stand here and go for true, in every sense of the word, holistic health. Holistic means mind, body, and spirit. I do the body part, but the mind and the spirit part, I don't. I just encourage them towards the right professionals. That's why I'm fascinated by what you guys do.
Yeah, yeah, and I know that a lot of clients who like come in to see us, their main goals are oftentimes to like feel more authentic, to feel calmer, and also to feel more confident. And I'd love to kind of like go over some like maybe like general cases or case examples of some profiles of people who come into our office so you
Oh,
can
sure.
give a little bit more feedback on how you might help specific folks who come in. So we specialize mostly in working with women who want to feel more empowered in their lives, but we see everyone. We see anyone 13 and up, anyone who's looking to overcome trauma, to reduce anxiety and depression, actually heal from it, because I think there's a lot of stereotypes that depression's a disease that you're going to have forever.
Yeah.
It is not necessarily something you can heal from, but we know the science is telling us a lot of different things now about that in the gut microbiome. So that's why I'm so glad that we were able to connect and be able to help clients in a more holistic way. Um,
Yes.
Most of our clients who come into our office are actually women in their 20s and 30s, and they're usually struggling with anxiety most of the time. And oftentimes I see with the anxiety, there's oftentimes some stomach stuff going on, usually a lot of nausea related to that anxiety, shortness of breath, and also a lot of sleep disruptions, such as like either trouble falling asleep and staying asleep or just like pure insomnia. And I'm curious for someone that age who's coming into your office, how you might help them.
Those ones, almost right away, I want to see what their stress hormones are. I would say first thing we're going to do is saliva test. Let's just see where you are, see if you're in some state of adrenal fatigue. The sleep, the disrupted sleep, or the person that said, I wake up at 3 o'clock in the morning, can't go to sleep, or I wake up at 1:05 in the morning and can't fall asleep. It's strange. A lot of times it's right on the hour for some reason, 3 o'clock in the morning. That's a sign of the body is running out of blood sugar in the middle of the night, and it's asking the brain for some cortisol so that, and I didn't mention before, what cortisol does is the adrenal glands secrete cortisol. The cortisol goes to the liver and tells the liver, can you please give me the stored sugar you have so I can dump in the blood so I can finish what I'm doing, fight off the tiger, et cetera, et cetera. But that's when they say disrupted sleep, I'm like, you got some type of blood sugar, adrenal dysregulation. I would say that'd be a great place to start. Diet, food logs is that is just the gem. That's one of the most valuable things that I could get from somebody. And when the more specific they are about their food log, the better. I don't care if it's how many forkfuls of something that they had. The more they tell me, the better. I would say that's a good place to start too, because that'll tell me about their energy level, in blood sugar and insulin spikes or valleys, and whether or not that they have like any type of complex carbohydrate. A lot of times they're flirting with some wacky diet too as well. That's just stressing their system out. But in that instance, that would be a great place to start. And then of course I would ask them about their digestive, do you have a history of digestive problems? Most of them do. I'd probably say about 80% of them do, or they're using a laxative, or they're using antacid, or they have bouts of constipation. They have food sensitivities to some type, or they have eating disorder too, very common too, which again, that is not my field, but I identify them pretty frequently. And when they open up to me and say, yeah, I have eating disorder, I've had one in the past, and that usually means that they're, again, trauma, self-esteem issues. They have some old injuries and hurts that they have to address. But that's where I'd probably start. Stress hormones, food log. That'd be a great place to start.
Awesome. Yeah. And so also we have some like older clients sometimes who seek us out for trauma treatment. And a big difference I notice in them is oftentimes autoimmune disorders. So that's like a big thing that I also see along with chronic pain. Sometimes I think maybe at that point a lot more depression I notice come up, and maybe oversleeping. And I'm curious, for someone who's, maybe a little bit older and has been struggling with some health symptoms for a long time, and it's kind of exacerbated at this point, and they're having more chronic pain and chronic health problems, how you might start working with them.
That's interesting. I would ask them if they have an established or diagnosed autoimmune disease, and this is where like medical insurance can really come in and help. Sometimes if they say no, but I got kind of pain, systemic pain all over the place, I will say that's one of the main things that got me from being a chiropractor into functional health as far as my clients. Person can come in and say, I have neck pain or back pain. And I say, okay, what would you attribute it to? Oh, old injury, or I strained something, I picked something up, or, car accident. I say, yeah. But when they say, I have systemic pain, I just have a pain all over the place. If it's not my arm, it's my shoulder. If it's not my knee, it's my back. It's something like, it's like wheel of fortune, wheel of misfortune of what my pain is that day. Like, what do you think? I go, you have systemic just inflammation throughout your body. It would be a good time to get a CBC on you to see if you have any hyperactive immune system, high white blood cell count. I want to check your vitamin D level, and I want to check your thyroid activity too as well. And also check for something called ANA, an ANA titer or panel. It's just like a general test for autoimmune disease. And depending on what they call the profile, what shows up, it'll lean me towards what type of autoimmune disease that they might have. That's probably where I would start with that person. Food log, of course, we would go back to that. A lot of times if they're chronic pain, weight's probably the issue, because weight and fat is an organ, just like your heart or your kidneys or your liver. It secretes inflammation. It doesn't just sit there asleep like it's stored energy, like it's a gas tank. It is very active in secreting things that cause inflammation. And like I said before, acute inflammation, you sprain your ankle, it swells up real big, that's great. That's your friend. Hurts real bad, good. The more the better, because the body's busy repairing something. It's the chronic low-level inflammation that eats up joints and causes that systemic type pain all over the place. So with that person, I'd say we're going to get a CBC on you. We're probably going to get an ANA panel. I'm going to check your thyroid. And we could probably, food log would probably help, or to assess them for weight issues, of course, blood sugar, insulin. Those are all things that we check, using typical medical insurance. And then ultimately, I'd probably say you're probably going to get a stool test. We got to see the state of your gut and where it's at, so that we can turn down that thermostat and turn down your pain, get you balanced again.
Right. Yeah. And I'm hearing, just by talking about these two cases, is there's like a lot of hope for these people, right? There's a lot of options.
Yep, absolutely. The knowledge that it's so interesting. It's like the answer is within the patient. The answer is not outside the patient. It's like we listen to the person. They will tell. It's like I tell all my interns. I usually have between 1 and 2 interns here a year shadowing me for months at a time. And I say the patient has, it's like a combination lock on the safe. The patient has the combination. You have to listen to them. They will tell you. And then you use the clues that you get off tests, and then you can backtrack, and then you can get a solution. They can always get better. People, I talk to them on the phone, people email me, they message me, can you help me? Can I get better from this? And I say, jokingly, I say, are you alive? Yeah, I'm alive. And I say, then you can improve, because your body's making thousands of cells every minute, every second. You're making hundreds, you're just making thousands and thousands of cells. You're making hundreds of thousands of cells in a matter of minutes. Your brain and your innate intelligence in your body is making the exact cells that you need based upon the stress that you've been exposed to right now, and it's putting them right where they need to be. Your blood pressure is high. Hallelujah. That's great. Your body's turning up your blood pressure to keep you alive. You are fearful. You are stressed out. You have low self-esteem. You have what people call psychological disorders. Those are normal responses to the traumas that you've been exposed to.
Right.
If I walk in my front door and kick my dog every day, and the dog becomes a skittish, fearful animal that lashes out in anger, is that wrong or is that right? That's nature. The definition of life is adaptation. It's like, that's what's going on, adaptation. But I tell those people, I say, you get that gut in order, you get your old traumas handled, and wait for the miracle. You might have to be patient, wait for the miracle, and the miracle comes from you. And no doctor gave it to you. No pill provided that for you. It's the innate intelligence that spins the stars in the sky and takes roast beef and mayonnaise and turns it into eyeball tissue. That's what's going to heal you, and you have more than enough that you need right now already.
Right.
Let's just get a little bit of science. I always say this, little bit of science with some great intention. Little bit of science with great intention from the right professionals, and get you on track and make you independent, so you can take care of yourself and stop being a patient and become a client that refers other people for help.
Right. Yeah, for sure. Yeah, and I think like maybe the last type of client that we see pretty frequently is moms, and especially like moms that have young kids, and they're oftentimes struggling a lot with like their hormones balancing back out after having children, and just the stress of having a new baby, and maybe some increases in anxiety and just trouble sleeping. And I'm curious, after childbirth, and young mothers, what kind of help could they get from functional care?
That is one of the most common and toughest ones, because you have the physical component, which is the absolute tornado of hormones that they've just experienced. That they went from ovulating and menstruating to now growing a child to delivering the child. For their hormones to return to that, I don't. The joke right here is, I don't think a man could survive it. As a matter of fact, and now that they have this new responsibility, this innate wisdom inside them, that mothering, nurturing instinct to put that child above themselves too as well. Their priorities shift, and their priority is not themselves. They just instinctively, when they obey their instincts, they don't take care of themselves. It's like that's what happens.
Right.
So to them, I say, look, you have to get a handle on who you really are. Yes, you love your child, but you have to love yourself too as well. You can love both, and you can love them equally too as well. For them, I would address their sex hormones and their stress hormones. Invariably, yes, they do have some gut disruption, but I usually start with those Dutch type tests. And Dutch stands for dried urine corticohypertrophin test.
Mhm.
Those I would say, let's see where you are right now, food log. Um, and then most likely stool test. A lot of times they have some type of gastrointestinal disruption. That's really helpful too. But that's where I'd start with them. Sex hormone, stress hormone test too. I would check in with them too about, and some people you can tell they got a good handle on it. It's their third or fourth kid. They got a great situation. Husband's gem, family lives up and down the block. They just love kids, but they're just a little burned out and fatigued. They're just like, man,
Right.
this is the fourth kid. We didn't know if we were going to do it or not, but we did it, and we love him. He's doing great, but I'm out of gas. What do
Right.
we do? And I'm like, cortisol test, stress hormone, simple as that. Let's see, before you get down into an advanced phase of adrenal fatigue, let's get you the herbs you need, the diet you need for yourself. And if you got those resources, great. Your focus and your challenge is going to be to do something for yourself. And
Mhm.
I would recommend some type of loving, caring counseling to help them make sure that the person inside them, who they really are, gets nurtured and doesn't get put on the back burner too, as
Right.
well. And that's in the best interest of the whole family too, as well. But like I say, working with other professionals that do those type of services, I don't do those things. I just do, be pretty easy. I do stress hormone testing. That's where I would start with them. And then I would ask them, what are they doing for themselves? And are they getting professional help to make sure that they're staying well, spiritually and emotionally?
Right. Yeah. And yeah, so thank you so much for taking the time to explain a little bit more about functional medicine and how it might help some of the people who come into our office, but also people who are just struggling with mental health issues.
Yes.
I'm wondering how people can find you online and where your office is located and
Oh, sure. Yeah. I'm in Troy, Michigan. And we get we get people from Shanghai, we get Puerto Rico, South America, Europe, Canada, of course, too, as well. The best thing to do is just find us, hit our website. It has a lot of great information on it. It's kind of long, but it's Back to Health Natural Solutions. Backtohealthnaturalsolutions.com. That's a great way to get a hold of us. Our social media is grown expansively too. You can message us anytime on Facebook Messenger. We usually respond within an hour. We have trained staff and trained natural health holistic nurses too as well, that can get answers back to you and point you in the right direction. And I pride myself on my ability to get people help no matter where they are in the world. No matter where they are, I will find them the best person for them. And I have met and talked to some of the most interesting doctors around the world too, from the Philippines, China. If I had their problem and I was where they are geographically, I will find someone locally for them. If we can't help them, that's where I would go, or I would send my mother to go. But yeah, back to healthnaturalsolutions.com. That's probably the best place to start. Anyone is welcome to message us. I'll never charge anybody to give them my opinion if I can help them or not.
Oh, fantastic. Cool. Well, again, thank you so much for taking the time to chat with me today and share about the healing that functional medicine can do us all.
Yeah, it's exciting, and I'm really glad to be a part of it. I feel like I'm on the front of a wave that's coming. Like I said, the people have spoken. People's innate intelligence, their innate wisdom wants something natural. We have that desire, and I'm just glad to be in a position where I can provide that type of care. And frankly, what I feel is the best available in the whole world.
Right. Yeah, exactly. And it's so cool that you were able to provide it to people all over the world who are searching for it.
Yeah, yeah, great place
Well,
to be.
yeah, again, thank you.
Yeah, thanks again for having me. I'll be glad to speak to you anytime, and be well.
Yeah, you too.